right, friends. So we have learned why dimensional analysis matters, why it's the best method, conversions that we need to have committed to memory, and now I'm going to take you through some step-by-step examples of how you will do this in practice.
I'm using this text from Elsevier.
I'm going to take you through some step-by-step oral dosages using dimensional analysis. I'm using Ogden and Fluardi's text here by Elsevier. I love this text because there are tons and tons of practice questions. I'm going to just keep it simple for this video, and then I'll add more videos with more complexity. If we establish the same habits every single time, when these start getting more and more complex, we have the muscle memory. So it's important to do the same thing every time. Number 1 says the licensed prescriber orders mini press 2 milligrams PO 2 times a day for Mr. Shaw's high blood pressure. How many capsules will the nurse administer per dose? So we have what we have ordered, what we have on hand. Those are our given quantities that we need to insert somewhere, and then what we need to end up with. So every question, write down O, H, X. Our order says 2 milligrams. So that's my order. What I have on hand is over here. I have 1 milligram capsules. So I have 1 milligram per capsule. And then what do I need to end up with? What's my unit of measure? How many capsules? So I need capsules. I like to set my question up with my unit of measure. So I need X capsules. Then you can most of the time just put your unit of measure on the denominator here. If you have kilograms, you could put it there. So I'm given, I need to insert my given quantities. I have 1 capsule equals 1 milligram. So this needs to be a fraction. So again, I'm putting my unit of measure. I'm starting my problem out here with my unit of measure. And now I need to multiply. So with dimensional analysis, we like to cross cancel. So what I have in my denominator here should match in my numerator here. In this case, what I have on hand and what I have ordered are the same unit of measure, so I do not need a conversion. I can just put milligrams here because then I'll be able to cross cancel these eventually, but this gives me the clue on what I need to put here. If my units of measure were not the same, this is where I would insert my conversion. So I'm told that my order is 2 milligrams. I'm not given anything else. So I'm just going to put this over 1 because I have to make this a fraction. Or you could even just put 1 dose here if you want. Now I'm going to cross cancel. I'm canceling this out. I'm left with capsules. So now I'm going to multiply 1 times 2 equals 2. 1 times 1 equals 1. This may seem very redundant for you. However, I'm telling you, when we establish good habits, it will make a difference when these get more complex. So I'm left with 2 capsules per dose, or even if you just put 2 capsules, you'd be fine there. Let's move on to the next question. Get that stuff out of the way so we can read it. I have my order, I have what I have on hand, and my unit of measure. Miss Taylor has a long time history of seizures. Elixir, that's a drink of phenobarbital, 30 milligrams PO every 12 hours is ordered. There's my order. How many milliliters will the nurse administer per dose? So my order is 30 milligrams. What I have on hand right here, this is my medication label. I have 20 milligrams per 5 mLs. And my unit of measure, I need to end up with mLs. So I'm going to set my question up with X mLs. That's what I need to figure out. I'm going to set my numerator up so these match. I'm given how many mLs I have right here. I need to insert my given quantities now. I forgot the little g here. Over 20 milligrams. Notice how my unit of measure that I have on hand and my order are the same, so I will not need a conversion. If I did, I'd insert it right here. I want these two to match, and they do easily. So I used this one already. All I have left is my 30 over 1, make it a fraction. Then I have 5 times 30 equals 150 over 20 times 1. And I'm left with 7.5 mLs because I cross-canceled these and I had my mLs there.
See how the units cancel every time? That's the power of dimensional analysis. No guessing, no shortcuts, built-in red flags, nothing but safe math and safe patience.
Number 3 says a licensed prescriber orders a medication 0.2 milligrams PO 2 times a day for 4 days, then 0.15 milligrams PO 2 times a day. You have the medication, same thing, available at 0.05 milligram tablets available. How many tablets will you give for the first 4 days? How many tablets will you give for each dose thereafter? Okay, so this is going to be two separate questions. Don't let the medication name trip you up, especially if you're taking your NCLEX and you are panicking because you don't know that medication, you don't remember it. It's okay. It's a distractor. Our first one for the first 4 days says our order is 0.25 milligrams, and we have 0.05 on hand available. 0.05. Make sure you get all the right zeros in there. These two units of measure match, so we know right off the bat we're not going to need a conversion. How many tablets? So I know that I need to end up with tablets. What I have available is per tab. I need to figure out X for tablets. So I'm going to set my numerator up with tab, so those two match. And I'm given that one tab equals 0.05 milligrams. I can cross that out because I inserted it. I need my denominator and my numerator to match. I don't need a conversion because they match easily. The only number other I'm given to insert is 0.2. I can put that over one dose equals, when I multiply 1 times 0.2, I get 0.2 over 0.05. I'm able to cross cancel these and I'm left with one tab. And I am given, when I divide those, I end up with 4 tabs. So this first answer is 4 tabs for the first 4 days. Now let's see what we'll give thereafter, because the next question is saying, what will you give thereafter? My order, what I have on hand, my unit of measure. My new order is, I'm going to cross that out so it's not distracting me, 0.15 milligrams. I still have the same tablets, 0.05 milligrams per tab. These two match. I don't need a conversion. I need to end up with tablets or tabs. X is what I need to solve. X tabs or tablets, same thing. I want to set my numerator up with tabs. I'm given this right here, so I'm going to put that in. I can cross that out since I used it. I want my numerator to match so I can cross cancel. And the only other given quantity I have to insert is my order. I can put that over 1 to make it a fraction. 1 dose equals 0.15 over 0.05. Cross cancel. I'm left with tabs only. And then when I divide that out, I end up with 3 tabs or tablets. 3 tabs. What my order is, what I have on hand, what I need to end up with, what unit of measure. Mr. Davis has a diagnosis of acute maxillary sinusitis. His licensed prescriber orders Biaxin 500 milligrams every 12 hours for 10 days. How many tablets will the nurse administer per dose? The order is for 500 milligrams. My medication label says tablets. There's 60 tablets, and they are 250 milligrams each. 250 milligrams per tab. My question is asking me how many tablets. I need to end up with tablets. Even if you think you could do this math in your head, don't do it, because again, we want to establish good healthy habits so that we do the same thing every single time. So I just inserted my first given quantity. I don't need to do a conversion. I'm going to insert my next given quantity, multiply 1 times 50, 250 times 1. I'm running out of room here, so I'm going to come over here. 500 divided by 250, cross cancel these, equals 2 tablets. 2 tabs. What I have on order, what I have on hand, my unit of measure. Mrs. Rios complains of nausea, compazine 2.5 milligrams, PO 3 times a day is ordered. The stock supply is compazine syrup 5 milligrams per ml. How many mLs will the nurse administer per dose? So our order is 2.5 milligrams. What we have on hand is 5 milligrams per 5 mLs. Notice how our units of measure match, so we don't need a conversion, and the question is asking how many mLs. We need to solve for x. So I'm going to start my numerator with this given quantity, which is 5 mLs over 5 milligrams. And cross that out because I just used it. I want my 2 to match. I have milligrams so that I can cross cancel. This is what tells me I need to put the 2.5 there. It's not giving me anything else, so I'm going to put it over 1. Could just cross these out right now if I wanted to. 5 times 2.5 equals 12.5 divided by 5. 5 times 1 is 5. And I'm left with 2.5 mLs. And then it's showing me the syringe here, so I need to show that I can tell how much solution I'm going to draw back that syringe for. So 2.5 there. What I have on hand, what I have ordered, my unit of measure. The licensed prescriber orders Ativan 250
Ativan,
milligrams.
2
How many
milligrams.
tablets will the nurse administer per dose? So this is tablets. I have 1 milligram per tablet. My order is 2 milligrams. My medication label tells me I have 1 milligram per tab. I need to end up with tablets. My question is asking me how many tablets. So X monotabs equals tab 1, and insert that over 1 milligram. I know milligram needs to be here. That's my other one, 2 milligrams over 1. So 1 times 2, 1 times 1 equals 2 over 1. I end up with 2 tabs. Again, seems like you could do the math in your head. However, establishing these routines and habits every single time will make all the difference, and it will start making sense when these get very complicated and we have different units of measure from the order to what we have on hand. The prescriber orders 20 milligrams of a medication. We have 20 milligrams here, and they're per tablet. We have 90 tablets, so making sure we can read those labels. My order is 20 milligrams. I have 10 milligrams per tab. I need to end up with tablets. So X tabs equals, what do I put in my numerator? Let's start with matching those. This is what I'm given. 1 tab is 10 milligrams. I want my numerator to match, and my units of measure are the same. So I don't have to add a conversion. It gives me 10 on the bottom, 20 on top. And my answer is 2 tabs. Alright, set it up just the same as everyone else. What I have ordered, what I have on hand, my unit of measure that I need. So we have our medication is scheduled, essentially the same thing as ordered, for 1 gram 4 times a day for Mr. Eaton to treat his urinary tract infection. What we have on hand is 0.5 gram per tablets. How many tablets do you need? So my units of measure are the same. I know that I won't need a conversion, so I need to figure out X for tablets. I want to set my numerator up to match, and then I need to insert my given quantities. I'm told that 1 tablet equals 0.5 grams. I want my denominator and numerator to match so that I can cross cancel. I have 1 gram here. I'm not given anything else, so I'll put it over 1. dose. 1 times 1 is 1. 0.5 times 1 is 0.5. Divide that out, and I'm left with 2 tablets or tabs. The licensed prescriber orders Prozac 40 milligrams PO daily in the AM. How many milliliters will the nurse administer per dose? So we have our order, what we have on hand, what our unit of measure needs to be. Our order is 40 milligrams. What we have on hand is 20 milligrams per 5 mLs. How many milliliters is what I need to determine. So I need to solve for X mLs. I want to start my numerator with that, and I want to insert my given quantities. I want my numerator and my denominator to match. I can cross that out because I've used it. All I'm left with is my 40 milligrams. If that didn't match, I would need to insert a conversion here. So then when I multiply 5 times 40, I get 200 over 20. I want to cross cancel these so that I'm left with mLs. And then when I divide 200 times 20, I get 10 mLs. Also, never forget to, like Ogden and Fluardi's book, they say, critically evaluate your answer. So just because you got the number doesn't mean you're done and you're going on to your next question. Always just stop and ask yourself, okay, does this make sense? 20 times 2 is 40. 5 times 2 is 10. So yeah, checks out. But when they get more complicated, you might not always be able to do that so easily. So you want to make sure that you are critically evaluating. So I'm setting up my next question, number 10. My order, what I have on hand, my unit of measure, Mr. Chang has Parkinson's disease and is to receive Cogentin 1 milligram PO at 1900. How many tablets will the nurse administer? So my order is 1 milligram. What I have on hand, let's see here. I have tablets, 0.5 milligrams. My units of measure match. I need to end up with tablets or tabs. So X tabs equals, what this is per tab. 1 tab equals 0.5 milligrams. I want to set this up the same. Use that. I only have 1 left. Not given anything else, so I'm just going to put that over 1. Then I have 1 over 0.5. I can cancel these out, so I'm only left with tabs. And that equals 2 tabs. Critically evaluate. That seems totally reasonable. Number 11, same thing. Orders on hand. Miss Martin receives Motrin 800 milligrams 3 times a day for arthritis pain. The drug is supplied in 400 milligram tablets. How many tablets will the nurse administer? So it tells us supply right here, but we also see it here. 400 milligram tablets. So the order is 800 milligrams. We have 400 milligrams per tab, and I need to end up with tabs. So X is what I need to solve for. I want to start my numerator with my unit of measure. I have 1 tab equals 400 milligrams. Let's make these match. I'm only given one other thing. My units of measure match, so I don't need a conversion. So I have 800 over 400. Once I divide that out, I get 2 tabs, and that seems totally reasonable. Next one, the licensed prescriber orders lithium carbonate 0.6 grams PO 2 times a day. The drug is supplied in 300 milligram scored tablets. How many tablets will the nurse administer per dose? How many milligrams will be given each day? Yay! We get to do a conversion. So our order is 0.6 grams, and what we have is 300 milligrams. See how these don't match? And then we need to figure out how many tablets and then how many milligrams. So let's just solve for tablets first. X tabs, set up our what we have on hand. 1 tab equals 300 milligrams. Now we're so used to just putting, we still want to put milligrams here, okay? Because we want to cross cancel. So I need to put 1,000 milligrams equals 1 gram. Now I need these to match still, so I need gram here. And this is where I can insert my other given quantity, 0.6 grams over 1. See how we did that? Now we get to go through and cross these out, cross these out. So that's why you need that conversion right in there. And then when I do all the math, and I do 1 times 1,000 times 0.6, I get 600. 300 times 1 times 1 is 300. I'm only left with tabs. That's the only thing that didn't cross cancel. And I end up with 2 tablets. For my first question. Now my second question, we have to go back and figure out how many milligrams. So we're going to have to write that out. This, what we have on hand, is 300 milligram per tab. And I want to figure out milligrams. So I'm going to do X milligrams equals, I want these two to match. So I'm going to put milligrams here. I have the given quantity of 300 milligrams per 1 tab. So I want tabs here. Uh-oh, what do I do? I have to go back to my previous answer. I had 2 tabs, remember? How many will the nurse administer per dose? We came up with 2 tabs. We'll put it over 1 to make it a fraction. 2 tabs, where's our 1 dose? And how many doses? 2 doses a day. So I can put dose here. I know this patient needs 2 doses per day. So then I'm left to multiply 300 times 2 times 2, which equals 1,200 times 1 times 1 times 1. So my patient is getting 1,200 milligrams per day. Because this checks out. If you want to do the cross canceling, we're left with milligrams per day. Last but not least, order what we have on hand. unit of measure. Your patient is taking minoxidil 30 milligrams daily for hypertension. How many tablets will you administer per dose? My order says 30 milligrams. What I have on hand here is 10 milligram tablets, 10 milligrams per tab. Notice how my units of measure match. And I want to end up with tablets. How many tablets? So I have to solve for x. One tab equals 10 milligrams. Other one I'm given is 30 over 1. So 30 over 10 equals 3 tabs, because these cross cancel, which just leaves me with tabs. Great job, everyone.
Keep doing this until it feels automatic for you. Again, the more we develop routines, the less likely we are to make a mistake when it really matters. Correct medication calculations not only save lives, but they improve our patient outcomes.